panelists that we have here. We have Dr. Vinh Chung. He is the dermatologist at Vanguard Skin Specialists. He is also a Mohs surgeon. He attended medical school at Harvard, and while he was there, he served as the pre-med advisor for Harvard College. And so he has interviewed candidates for college, medical school, and for residency programs. And then we have with us a nurse practitioner at Vanguard. Her name is Emily Reynolds. And after graduating college, she actually spent some time working in international public health. And so she spent 4 years in Afghanistan. And then she decided to continue her medical education. She did her Master's of Science in Nursing at the University of Massachusetts. She was in family medicine for a while. And then she did a very rigorous 2-year fellowship at the Leahy Clinic. And it's a nurse practitioner dermatology fellowship that's there. And then we have Joe Cari, who's a physician assistant at Vanguard. And then Joe, he also took kind of a longer path as well too. He served in the Marine Corps. So he did that for 4 years. And then he went to Winona State University and got a degree in mass communications and advertising. And he worked in that field for a while and then decided to enter into the medical field. And so he attended PA school in Massachusetts, and he has been in the dermatology field for a while now. And so we're fortunate to have all 3 of them at Vanguard and also presenting today. And so with that, just for the participants who have come on board, let me just say one more time that down at the bottom of your screen, there is a Q&A function. Feel free to click on that, ask questions throughout, and our panelists will be happy to answer your questions. And then I will hand things over to Joe, who is going to be the moderator of today's session.
Thank you, Lisa. I appreciate it. So once again, my name is Joe. We're just going to go ahead and start right into the PowerPoint. Feel free during the entire process, if you do in fact have a question as we go, don't be afraid to put a question in the Question and Answer Center. As we go through the entire PowerPoint slides, I'm kind of lean on Emily and Dr. Chung for information based on their expertise and their areas too. So I'm going to go ahead and jump in. Let's do this. Okay. All right. So again, we're going to go ahead and start from sort of the beginning here. And what we'll do is sort of have sort of the basics. Now, starting the entire process of determining applying for medical school, PA school, or nursing or nurse practitioner school, the first thing first, there's a saying that if you don't have a plan, you have a wish. And so having a plan and having a game plan of how to sort of execute to get to the goal of becoming a healthcare provider, that plan starts early. Myself, it was a 5-year process from deciding I wanted to do it to actually being accepted to the school. So that process for me laid out, like I said, in a 5-year plan. And that's the reason why I did that, because I had the true desire to become a PA. Initially, it was a career that I sort of thought I would like to do, and that got put on hold. And then eventually, when I had the time in my life in which I wanted to sort of execute, that's what I did. So don't put yourself through it for any other reason, not for someone else, for the prestige, for the title, for the pay, only if you have a true desire to become a healthcare provider, because it is a sacrifice. And that being said, prepare to work hard. You want to work hard because it's going to pay off in the end, but you want to learn to balance activities you enjoy. When people are out there partying, having a good time, you're inside studying. Again, give yourself a little bit of time to do activities you enjoy, but know that it's going to be a journey. It's going to be a marathon. It's not a sprint, to say the least. And understand the realities of getting into healthcare. It is a very competitive field. A lot of people want to do it, but you want to keep a positive attitude and open mind. Not everyone's path is the same. and that path may change. You may think that you want to do one thing, and as you start studying and being introduced into more aspects of healthcare, that may switch, and that may change. So keep an open mind. Emily, do you have any thoughts on any of those sort of basic aspects?
No, I think you summed it up really well. It is quite a commitment, especially depending on what path you take. MDs have a very long path, but very fulfilling as well. So yeah, I think you hit it right on the head, Joe. Thanks.
No problem. Dr. Chung, anything to add on that?
Yeah, I'll say that right now, when I do my work, I get paid very well as a doctor, and I'm getting paid for all of those late nights that I spent studying in college and medical school. And I'm getting paid for all those years that I spent in residency. And so you just got to understand that the work is worthwhile, and you will be compensated for it, but it'll just be many, many years down the road. And so as you think about it, is it worthwhile or not? The answer really, you should ask yourself, well, am I going to be able to go through it to the very end? And only then is it worthwhile.
Great point. So that takes us to the first important factor to being accepted into any program. Is going to be, the first one is grades. Maintaining a competitive GPA is necessary for many of these schools and many of these programs. If you do some research, many schools require an average of 3.6 to 4.0. Could be overall and or science GPA. Again, each program is going to be different. GPA tends to be the number one factor that schools consider to sort of bring people along in the process. If you can't keep a high GPA in college, chances are maybe medical, PA, nursing school may be too tough to handle, but that's okay. If you find out through the process maybe that you want to change to something else, that's totally okay. I will never be a computer programmer. I know I will not enjoy it. I know that's just not the way I studied, not the way I learned, but that's okay by me. So if that is your path and that's truly what you're going to do, and you're having a little bit of trouble in college, again, start early, talk to your advisor, changing study habits, finding out if you, in fact, are just a better just reader studying on your own, studying with individuals, having mentors to help you sort of along the way. But don't give up and don't be too hard on yourself. If that is your ultimate goal, then put in the time, the effort, the energy, and know that a B on a test isn't going to end your life or cause any detrimental harm. You just need to sort of retool and get going. The second aspect in terms of important factors for applications to submit programs is going to be the prerequisite classes. Whether it's med school, PA school, or nurse practitioner program or nursing school, there are certain prerequisite classes that different schools require. This right now is just sort of an example I pulled off of the University of Colorado Medical School website. And you can see the programs requirements in terms of a year's worth of human bio, gen chem, organic chemistry, general physics, all with labs. Again, English lit, composition, a year's worth, and a year's worth of college level math, algebra above. Did you want to mention anything else on this slide, Dr. Chung?
Sorry, no. So thank you, Joe. These are basic courses. Again, they could change over time and across different schools. And so before you apply, you do want to check with the medical schools or nursing school, PA schools to make sure that you have fulfilled the requirements.
Perfect. On the other side of the coin, University of Colorado PA School, again, some of the classes are similar. However, some are different as far as what they're requiring. Obviously, some general biology classes are different, anatomy, physiology before you apply. Some psych and statistics and genetics. Like Dr. Chung pointed out, finding out what each individual school requires is probably one of the most important aspects and probably labor intensive. in all these programs, finding out sort of where you want to go, what they require. I mean, taking one class versus another could mean a difference of applying to 3 schools versus 7 schools. So keeping that in mind. And I mean, I'm gonna let you touch on the nurse practitioner and nursing option here. It's a lot of stuff.
Yeah, sorry. So there's actually a lot of different avenues that you can take to become a nurse practitioner. So you can already have a bachelor's of science in nursing, and that makes the process very easy, because you can basically find a 2-year program anywhere in the country, and they have their own prereqs for that, but a bachelor's degree is required. And then there's an RN to NP. So if you don't have a bachelor's degree, but you are an RN, that's typically a 2 to 3 year program. You usually are granted a BSN in the meantime. And then there are accelerated programs. So I actually did an accelerated program. It's also called a graduate entry pathway program. And that is actually a kind of a key word when you're trying to look up places that have these programs. They can sometimes be a little bit tough. And then sometimes schools call them accelerated programs. So they are typically 3 years. There are very few in the country that are only 2 years. And I would actually encourage a 3-year program. I think it's a lot to fit in a 2-year program. And those have their own specific prerequisites as well. I do encourage, if you decide to look at this, start creating a spreadsheet of what is required for each program, because it differs pretty significantly sometimes between programs. And then there's a BSN to DNP. So the DNP is a doctorate in nurse practitioner, and that can be a 2 to 3 year program, and you have to have a bachelor's degree in nursing, but then you have a doctor after your name at the end of it. And then there's you can also sorry, I forget what I was writing when I wrote this here. You can also sometimes do a BA to doctor of nurse practice as well. Those are hard to find, but they are out there. And if anybody has questions on kind of where these programs are, I can give you some guidance. I would say mainly they are on the East Coast. California has some as well, and Oregon, but the Rocky Mountains, Colorado, anywhere near us do not have these accelerated programs. In Colorado, you can only become a nurse practitioner through a 2-year program if you are previously a nurse. So the accelerated programs are a little bit geographically spread out. And then the last thing that I do recommend is a lot of NP programs are online now. From my personal experience precepting NP students, I would highly recommend an in-person program. I think they're more valuable. The students are more prepared. They are more confident in their diagnoses and their approach. I think you lose a little bit of that with the online programs. So it is something to consider as you're researching. And then there's also specialty tracks. So when you apply to become a nurse practitioner at an NP school, you actually have to choose your track ahead of time. That is different than medical school. Medical school, you get to kind of hang out for a few years, figure out what you like. NP school, you need to know what you want to do when you go in. Family has the largest scope. It has the most flexibility. You can see any age group. There's no restrictions on your scope of practice, which is great, but it does have a larger course load. It tends to take a bit longer to complete. It is time intensive, and that's the one that I went through. PEDS is another option, women's health, and there's a new track called adult gerontology. They used to be separate, but now they're together. And then there's psych and PEs. again, you should look up your prereqs before you apply to the school to make sure that you would qualify. I think that covers all the slides. Sorry, Joe, I can't see everything on the presentation.
No, that's okay. So moving along, so the other important factor, so we talked about sort of wanting and knowing you want to do it. We talked about having GPA that's aligned, and then obviously admission testing is kind of another aspect, it's kind of another hurdle you have to jump into is to some of these schools. Med school, everyone knows about the MCAT. Getting a certain score is going to determine if you're accepted, not accepted, and where at. PA school, there's actually three options. There are certain PA schools that do not have any admission testing. Some PA schools require a GRE and have to maintain a certain score for the GRE for acceptance. And just recently, over the past year or two, they've come out with a new admission test called a PA-CAT, sort of taking a page from the MCAT book to try to provide another sort of admission test to determine if a person's going to be successful in PA school. And then it looks like for nursing in preschool, GRE or none. Do you have any thoughts about MCAT's thoughts, Dr. Chung?
Sure. So I'll take this time as well to answer the question that that someone wrote in. And let me read the question. If my GPA is below 3.6, will going for a master's degree help if my GPA during master's is 4.0? So that's a tricky question. The real answer is it depends on your MCAT score if you're applying to medical school. I think that GPAs, when you apply to medical school, you want at least a 3.5 if you want a good chance of getting in. Obviously, if it's a little bit lower, then you just have to apply to more schools. But what you need to round out this testing portion and the GPA portion is a really high MCAT score. I think that would be more important than getting a master's degree. Certainly, a master's degree it could be helpful, but it needs to add to your personal story. If it's just a matter of spending a lot of money, spending 2 years to get a master's degree that doesn't fit into your personal story about why you want to go into medical school, then it probably would not help you much. So those are my thoughts.
Excellent. Emily, anything to add on the nursing NP school portion?
It really varies based on the school. From the research that I was doing, not all nursing schools require the GRE, but the GRE is quite common. And I would echo what Vin said. I would not get a master's degree and spend a lot of money if you're not sure. I would apply to medical school if that's what you're wanting to do and just see if you get in, because that's a huge commitment. Master's programs are typically 2 years. I don't think I would go down that path. You won't know until you try it. And I actually don't think there's harm in taking some time off between college and your master's program, whether it be med school, PA school, or NP school. I think that makes you a more mature student. It does add to your story, like Dr. Chung was talking about. And it makes you understand, hopefully, what you want out of your future career.
Yeah, and I know for PA school, there's two GPAs they tend to look at simultaneously. They look at your overall GPA and you look at your science GPA. And so in certain circumstances, certain PA schools require a certain science GPA for admission. There's quite a few people who have taken some science courses, anatomy and physiology, for example. They take the course when they're freshmen in college and they do hot, and then sort of later on, before they apply again, they retake the course. And to speak to that again, the school that I applied to, they had a 5-year window on specific courses. So anatomy physiology, you had to have taken the class 5 years within a time frame of 5 years before you apply. So I, unfortunately, it was, a little bit older. So my time I took the class was 6 years. So I had to actually retake anatomy and physiology because I had a good grade, but it didn't meet the time frame requirement that was required for that particular school, unfortunately.
So I'll comment one more before we move on. I feel that a lot of people applying to medical school, you're asking the question, what does it take to get in? Or how do I get in? Those are good questions, but the question that you really need to ask yourself is, why do I want to get in? Okay? Because you need to have a very good understanding of yourself, requires a lot of personal reflection. And I know that a lot of people probably think that it's the end of the world if you don't get into medical school. What's worse is if you actually get into medical school and find out that you don't belong there and you would have spent a lot of time and money investing in it. So you should really ask yourself the question, why do I want to go to medical school? And like Emily mentioned, spend some time, work, do travel, volunteer, because you really need to answer that question for yourself, why you want to go before you make that commitment.
Excellent. And Dr. Chung, you actually made a good segue for me, right to medical experience, so volunteering. So many medical schools, PA schools, etc., they want to see that you have been exposed to the field. There are certain ways that you can get medical experience and or volunteering experience. Working in a hospital clinic, shadowing, I thought this was probably one of the most important aspects that I did and my process was I shadowed a PA for about a week in a primary care clinic, saw what they did day in and day out, and really sort of asked myself, is that truly what I see myself doing, and how, and do I see myself providing this type of care to people? Becoming an EMT or a CNA or something, a scribe or something along those lines could help in two ways, kind of show you exposure, one, and then see if it's healthcare is truly for you. I was a nursing assistant for 2 years, and I was told by someone if I couldn't handle that job, then could I handle being a healthcare provider? Because you're in it up to your knees and busy all the time, and it was a satisfying job for me, and I knew that's truly when I wanted to be a healthcare provider. But gaining experience as soon as possible helps out. If you're like, oh, I want to do this, and you spent 3 years studying, and then all of a sudden you're like, oh, well, I might as well check to see if this is what I want to do. You're putting yourself behind the 8 ball in those aspects. Volunteering, vastly important, not just for your overall worldly view and education, but also it helps in terms of on an application. Many times I've had people tell me that you don't want to just do a shotgun approach and try to volunteer at 25 different places. Pick a few that for you means something, that truly means something to you, and put the time in, and not just enrich your application, but it'll enrich yourself. Emily or Dr. Chung, you want to add to that at all? No? Okay.
No, I'm good.
I'll let you comment, Emily.
Okay. Okay, well, I'll move forward then. The next important factor is activities, okay? Schools don't want to see robots. They don't want cookie cutters. They want people who are individuals with individual experiences, individual thoughts and feelings, and how they've approached the world in different ways. Having hobbies or interests just besides for getting into school. Leadership positions can look impressive on application, but then again, like I said, they'll make you grow as an individual. I mentioned picking a few clubs and sticking with them and dedicating your time to them. Research from what I've read is another great activity to get involved in. Some universities have research programs with local hospitals, but making sure, just as before with any volunteering or activities, the research is something you want to get interested in. And some people try to get published and some people don't, but that's kind of up to the individual person. Any thoughts from the other panelists?
Yes, I'll come. Oh, sorry, go Emily. Yeah. So activities, volunteer, another degree, all that stuff. So what you want to demonstrate is depth, not breadth. Okay, like Joe said, do not volunteer to a whole bunch of different things. 2 weeks here, 3 weeks there. That to me, if I were to look at someone's application, I would that would be a red flag to me, indicating that this person does not have commitment. I would rather you stick with something that is really meaningful to you, that you can stick to it for a long period of time and to gain something valuable from it. Because the admissions committee is looking at depth so that they can see the characteristics of who you are. They want to see your character. And so as you think about these activities and degrees and all that, it needs to represent your character. And so it needs to tell a consistent story regardless of what you do. And so I was always focus on depth instead of breadth.
Excellent. Emily?
I agree. And I guess I would also encourage, I just felt like personally for me, because I traveled during my time off between college and my master's program, that gave me a huge advantage when I was applying because it was unique. It wasn't something that a lot of people were doing. So finding something that you're interested in, but also makes you unique for the future can be really advantageous. I mean, I loved my job also, so that was really helpful. But it is good to kind of get outside your comfort zone, do something that might not be what the next person is doing. I think that will shine.
And one thing that I've noticed is as I've practiced as a healthcare provider is that these unique experiences, as both Dr. Chung and Emily have talked about, they give you a way to connect with your patients. If someone has done something or been somewhere, lived somewhere, you can say, "Oh, I've been there too." You can discuss things. It allows you to better connect as an individual and not just be sort of just a provider. It's a way to connect individually with your patients. That's one thing that I've noticed. Okay, so some more important factors, recommendations. So some schools require 3 to 5 recommendations from professors or other working professionals. Some letters of references, recommendations. Again, having one from a volunteer research mentor. Sometimes acting early can help sort of put a seed in an individual's minds to get a letter of recommendation later on, and get to know your professors, and instead of just sitting in their class, allow you to ask more questions and sort of be interested in their area of research, and who knows what that may be able to lead to. But most schools require letters of recommendations from a few individuals. Personal statements. I believe for every single one of these professions, one of these schools require a personal statement that you need to write down, saying who you are, why you want to do what you want to do, and tell me your story. Required mainly for the primary application. It's very important to be honest and be yourself. Don't try to be who you think they want you to be. Okay. A lot of times it sounds false when you're reading through some of them, because I've read a few. I'm sure Dr. Chung's run a lot more than I have, but you can see when people are reaching. Write mini drafts sometimes, and people know who've written papers before, you tend to miss the little spelling errors because you've read it 5,000 times. So write mini drafts, have a lot of people read and critique it before you submit it, just to get that extra feedback. Any recommendations or thoughts, Emily, Dr. Chung?
Your personal statements are the only opportunity that you have to show the schools who you are. So you really want to focus on it and, again, show what makes you unique compared to the thousands of other applicants that are out there.
And it might be after writing your personal statement, you realize that you can't convince yourself why you would want to go to medical school, PA school, and NP school. And that would be a good revelation, because you can't convince yourself, what makes you think that you can convince the admissions committee, right? So I think that it's an excellent exercise to put in writing what you really believe and what you want, because you need to know for yourself why you're doing this.
Okay. I don't know if Emily or Dr. Chung want to read the question and answer comments. I can't see them from my end, unfortunately.
Oh, I'll take it.
Okay.
The question was, do you think not having any research experience, but lots of other hobbies and activities would be a downfall to my application to PA school? I don't think that that's a downfall. I actually know quite a few people who have gotten into PA school that didn't have a lot of research experience. So I don't think that's a requirement.
Yeah, I didn't have any research experience. So.
Yeah, research is certainly more valuable for medical school, but it certainly isn't absolutely necessary if, again, you have a compelling story. If you, in your personal statement, say that you want to become, you want to find a cure for AIDS, but you have no research experience, then there will be a discrepancy. And so it really just has to be consistent with your story.
Gotcha. Any other questions, guys? Sorry, I can't see it on my screen. Okay.
Yeah. And the other question is, are there opportunities to volunteer work through Vanguard? Tough question. The simple answer is not until you are in medical school or PA school or nurse practitioner school. So we have it for existing students. Now, certain providers may offer shadowing opportunities, but not any real work.
Gotcha. All right, I'm gonna move on. So, next phase, next step. You've gotten all these things lined up, knocked down. Now it's time to actually put your application together. Okay, so this is a labor-intensive process. In most cases, there are essential application services, the AMCAS for med school, DO school, the CASPA for PA school, and most like the nursing CAS. That's where in many cases you're compiling all this information, your personal statement, all your letters of recommendation, your transcripts from all the schools you've been to, which can be a pain if you're like me and you have to go back in years and years and find them and get them and submit them. So once you do that, you sort of combine all this information, all this stuff into your application on this centralized service. And at that point, in most cases, almost all schools accept those. So you'll pay to send that sort of application package to these individual institutions, and you're paying a substantial amount every single time you send. So I think when I applied, I sent mine to 9 different schools. Again, vastly important to, before you press the send button, they'll accept your money. The schools will accept your money. Please ensure that you double, triple check the prerequisite classes, prerequisite things that the individual school will need. If you're not meeting that end of it, that basic requirement, you're not following those basic directions, they'll just say thank you for the $150 for this application and next in line. So Emily, Dr. Chung, you want to add to any of that?
Joe, you have so much more experience with this. I applied to NP school 13 years ago and I printed everything out. And you remember when you had, well, you don't remember maybe, but you had to get like nice paper to like show quality work. I know nothing about.
Gotcha. Okay.
Well, I would say save up money and apply broadly.
Yeah.
Yes.
You got to do that.
Good.
So let's say you want to, take a vacation on spring break and spend $1,500 to go whatever, skiing or go on a cruise or whatever. Don't do that and use that money to apply to 10 extra schools. And again, that's another test that you need to ask yourself. Do I really want to go into PA or med school? How much do I really want to do it? And if you are not willing to give up a spring break to apply for 10 extra schools to increase your chances, then maybe you should consider something else. And again, I'm just trying to, make it difficult on you. The challenge is that when people apply, you often think that, okay, my scores are good enough, and I have all these ducks in a row, then I deserve a spot. The answer is that no one deserves a spot. You do all you can, and you hope to get a position, but it's not guaranteed. And so you really do have to apply broadly and ask yourself seriously, are you willing to do what it takes to get that position? Because getting into school is just the first step. It's just the very first step of a very, very long road where you're going to spend many years studying for it.
I think as an example, the MA that worked with me most recently applied to 19 PA schools. He got 9 interviews and he was waitlisted at 4 schools. He did get into one of them, but it was not it was not a given. So and then he had to travel to the 9 interviews, which are all across the country. They're not in Colorado. So it's very different from when I applied. I applied to 4 or 5 nurse practitioner schools. I was living in Massachusetts. I drove to all of my interviews. I got accepted at all of them, which I was very fortunate. But it's very different when you have a ton of competition for PA schools and when you live in a region that just doesn't have a lot of schools.
Yeah, I remember when I applied to 9 schools, and I got 1 interview. And that's not because my grades were horrible or anything like that. It's just kind of how the cookie crumbled, if you will. But I remember asking at the AT Still University in Arizona, where I was living at the time, they had for one application cycle, they had 3,000 applicants for 30 spots, and every single one of those people want to get in. Every single one of those people are working hard to get in. And like Emily said, hey, if you could interview, you're like, well, I don't know. Well, eventually you have to make a decision. If you want to fly to these locations, I had to fly to Massachusetts. I had to stay in a hotel. I had to do the interview, and it can be very costly and time consuming if like Dr. Trent said, if that's truly not what you're wanting to do with the next 4, 6, 8, 12 years of your life. So
I think Joe, I'm just gonna answer a question,
oh,
if you
perfect.
don't mind.
Yeah.
Is there a correct order for volunteering, taking, or studying for the MCAT, etc.? Would you discourage me, I'm assuming, from doing them at the same time? I think it just depends on your time management and how much you can take on at once. That I don't think that there's a specific order that you need to follow. From what my MAs have and other MAs at Vanguard have told me, taking the MCAT is pretty time intensive. You need to study. There's often times that folks take a study course for it, which is pretty time intensive. So it just depends on whether you can fit all of your activities in and take the study and take the MCAT at the same time.
So my answer to that would be yes, meaning you need to do all of it at the same time. Because if you're unable to hold a full-time job and still study to take a test and pursue something that's meaningful and reasonable, medical school may not be something for you. I hope you all know medical school, there's a huge rate of burnout. Things do not slow down ever. Residency is brutal. When you go out to work, it doesn't slow down, especially there's certain, if you go to certain fields, like being a surgeon, you could be on call every 3rd night, every 4th night for the rest of your career. You will have a family. It does not slow down for that. You will have boards that you have to take. It doesn't slow down for that. And when you're working as a resident or outside in the real world, you're not able to take any time off to study for the boards. You do it on top of everything. So that's what I would say, at least for medical school. And so you really, again, ask yourself that question: do you really want to do it? It doesn't mean that you have to enjoy it, but you just got to understand that if you choose to go into medicine, this is what it means. It's not a 9-to-5 job. And you do not get breaks, and you do not get breaks when you have a baby, when your kids have birthday parties. You don't get breaks. You're expected to do it all on top of it all at once.
And I think that's why when we first started the presentation, having a plan helps at least organize all these many things that you have to take in consideration. If you're not an organizational type, get organized and have a timeline or a plan to be able to accomplish these things in a specific order if you're that type of person. Okay.
So there's another question. And having said that, and again, I'm not trying to scare people off. Having said that, I love my job. I cannot imagine doing anything else. I'm so glad I went through it. The sacrifices that anyone who's gone through medical school, including myself, have made is tremendous. And I don't regret it at all. But you just got to go in with your eyes open. And believe it or not, right now, studying for the MCAT, volunteering, having a job, this is the easiest thing compared to the rest of your career in medicine. This is the easiest it will ever be. It only gets harder. And so you just gotta look at it with your eyes wide open. Is this something I want to do or not? Having said that, I love what I do, and I would not want to do anything else. So there's a question, another question. How important would you say getting a letter of recommendation from a PA MD is? Is this fairly equivalent to a close professor, or is it considerably more important when applying? The answer again is depth. I don't care what letters you have after your name when you sign a letter of reference. I'm looking for character. And so if it's a PA, MD, PhD, doesn't matter who it is, it needs to reflect that this person knows who you are beyond just your ability, and to attest to the strength of your character. And so to me, that's more important than what degree that person has.
Any more questions on that? I can't see, like I said.
There's one more, but let's move on and come back to this question.
Perfect.
Great question at the end.
Okay, so the last step, that's the interview. Now you've made it through the numbers game. Now you're sitting in front of an actual person who is going to determine, along with the committee, yay or nay. Okay, it's a huge factor. It's the last chance to kind of sell yourself. It's the last chance to show them who you truly are and what your values are. Okay, they want to see if you are personable and can communicate. Do you have the basic level of skills needed? Can you talk well? In order to have a good interview, that's important to get informed about the particular school. Okay, and most times they're going to ask you about why do you want to go specifically here. If you can't give them a straightforward, educated answer, then it shows that you haven't done your homework. Read up on current events, healthcare, and politics. I know during my interview they asked me, I think, one of each of those categories. Know why you want to be a healthcare provider and where you stand on some ethical issues. They could very well ask, what would you do in specific situations, more generalized. It's easy to say be confident, be relaxed, but try as much as you can. The more confident, more relaxed you are, the more prepared you are. Okay, so if you don't know the answer, and this is very, very important, be honest. Don't try to BS your way through a question if you truly do not know. That applies even now for me nowadays. If I don't know a question, an answer from a patient, I just tell them I don't know, but I'll find out. Very important. You look professional. That is actually very, very important. So if you do not know how to have a proper suit or business attire, interview attire, look it up online, get some help. Dress up more than dress down, trust me. And most importantly, be yourself. That will shine through during the entire process. For my interview, I definitely prepared. I had a few sort of generalized areas that I wrote down for myself that I wanted to convey, and that I knew I wanted to show the interviewers. And so I knew that many questions were going to be asked. I'm not sure what exact questions, so I didn't memorize specific questions. I just solidified who I was, and I wrote down, these are the aspects I want to convey to them. And that's how I went through my interview process. I know Dr. Chung or Emily has probably a few tidbits on this aspect.
Go ahead, Dr. Chung.
Again, it goes back to the question of why and who. And I'm speaking from the perspective of someone who's interviewed medical students, residents, today interview staff members, interview medical providers and all that. By the time you reach the point of the interview, it doesn't matter about what anymore. We've already screened through your GPA, your CV, your MCAT scores that, like Joe said, you've already played the numbers game, you made it through. Now I'm going to sit there looking at you in this room, eyeball to eyeball, and I'm going to look at you and wonder, who is this person? Is this person consistent with what I've read on the pieces of paper with their numbers, all the letters, references, and all that? I'm just asking myself, who is this person? And why does this person want to become a PA or a doctor or an NP? And there needs to be clarity there. The story needs to be consistent. And as an interviewer, I will push and push and push until you say, I don't know. And the sooner and the more sincere and honest I feel that you are, the more likely I'm willing to trust who you are. Because at the end of the day, that's what I'm trying to do. Do I trust this person to become the doctor or the NP or the PA for my mother, for my father, for my children? And so that's why I'm asking that question. Who is this person? And why do they want to do what they want to do? And so that's to me is the purpose of the interview, is to delve deeper and deeper to reveal the character of the person sitting in front of me. And so just understand that you're not going to impress any of the interviewers. They have thousands and thousands of people. You're not going to impress them. And it's okay to say, I don't know, like Joe said, because right now, I also say I don't know all the time, because the admissions committee is also looking to gauge your sense of humility, because that is one of the essential criteria to be a good medical provider: humility and integrity. Emily, anything else you want to add?
No, I agree with you.
Okay.
Yeah, so I did want to just add on a little bit for the NP role. It's really important to understand the NP scope of practice. So depending on the state that you're in, your scope of practice can change quite significantly. So if you're applying to a school in Massachusetts, an NP role there looks not very different, but kind of different from Colorado. So it's good to research the state laws and understand what it's like to be a nurse practitioner in that state where you're applying to go to school. And it is more than prescribing privileges. In Colorado, I do have prescriptive authority. For example, Dr. Chung does not have to co-sign my prescriptions, but in some states that does have to happen. Some states you can't prescribe certain medications, but it's more than that. There's actually laws in each state per specialty where you can and cannot do certain things. So again, it's good to just research and make sure that you understand where you're going to be going to school if you do get an interview, and just kind of get that background and really delve into it. The American Association of Nurse Practitioners is a great resource, and it can be very helpful in kind of delving into that. And then I actually did a little research on how to apply to NP school, since it's been a long time since I've done it. But one of the websites recommended not using the phrase mid-level. That is a phrase that I use, my colleagues use, but in an academic setting, it is a good point. Academic settings do not like the word mid-level. So if you're applying to an NP school, call yourself a future NP. If you're applying to PA school, you should be referring to it as physician's assistant or PA. It's political, whatever, but it is something that people should just know about. And then for NPs, really, you want to hammer home the holistic nursing approach. That is how NPs separate themselves from PAs, from my teachings. There's something called the nursing model. You spend a lot of time learning about it, nursing theory. Basically, it's just taking the entire patient into consideration, not just their clinical illness, but their social status, where they came from, ethnicity, everything like that. So nursing is very holistic and really likes to hone in on that. So you do have to kind of research that and make sure that that you're comfortable with that you're comfortable with that kind of touchy-feely side of being a health care provider.
So that was a great resource, AANP. I wanted to, let me see if I can give you, for PAs, for PA school, there is a website or association called PA, if I can do this, there we go, PAEA.org or .com. I'm sorry, I have a hard time remembering which one it is, but that's going to list all the accredited and non-accredited and other physician assistant schools in the United States. So there, I think when I applied, there was 144 schools in the United States, and I think there's 175 now. I could be wrong. That is actually a great resource to find out schools in your area, and then you can go to you can search that based on different admission tests requirements and a few other information. So PAEA.org or .com. Sorry, I'm not familiar, but that'll give you a good understanding of the schools out there.
So one of the questions was, what are the advantages and disadvantages for, this is the last slide, sorry, right, Joe?
This is the last slide, yeah.
Okay.
Do you want me to just clean out of there? There you go.
What are the advantages and disadvantages for the different professions, PA, MD, and P? So Dr. Chung, why don't you start with that as from an MD perspective?
So I love being a doctor. I love having all the opportunities available to me. I recognize that there is there's a time commitment and sacrifice that you have to make to be a doctor, but I feel that that's just more consistent with who I am. And I also like the fact I do not have to report to anyone, so I don't have a supervising doctor. And so again, that's just more consistent with my personality that I've discovered over time. But I love to be able to do surgeries as well, which as a doctor you're allowed to do. You can go to any specialty that you want, from psychiatry to pediatrics to radiology to any surgery. And so for me, I just like having all those options open. But certainly, it is not for everyone, and people may not feel the same about having all those options open. And so I'll hand it over to Joe and Emily to talk about, kind of what your thoughts for your decisions, because certainly it's not for everyone.
True. So for being a PA, I love being a PA. And the reason why I chose this particular profession instead of medical school was several reasons. One, I was a little bit older when I started the process. I had a career before in corporate America, and I had sort of a changing of heart. I had a healthcare itch I've always wanted to scratch, but never sort of went on. And I said, well, I don't want to be 50 something years old when I eventually started to practice medicine. So timing for me was an important aspect. Some women that I've talked to in my class, they said that they wanted more freedom as far as for having children, so they went to PA school instead. And another aspect of being a PA, which at first I really liked, was that as a PA, you can have what's called lateral movement within healthcare. So as a physician assistant, you're trained, you're taught in a medical model as a primary care physician assistant. So to work in a primary care setting, a family medicine setting. And then if you choose to, you can do a PA residency, or you can just sort of transition into sort of an on-job training in a particular specialty if you're willing to, if you find a physician who's willing to sort of bring you under their wing. I've always been the kind of person where I'm interested in a lot of different things. And so I thought, well, I would love to do medicine, and if I want to do pediatrics, I can do pediatrics. And then let's just say in 6, 7, 8 years, I want to try to do orthopedics or surgery that might be interesting to me. I can actually make that lateral transfer with as a PA. It just so happens that I found what I really love to do, and I don't necessarily need that aspect. So that was kind of a moot point. But some people really pick the physician assistant career path because of either time and to being able to move laterally, and especially what's going on sort of in the COVID pandemic. There are many PAs right now that are actually pivoting from surgery from other areas in medicine to working in emergency room settings or urgent care settings to help out some of the need. So that's why.
Being an NP is very similar to being a PA, but you do have to choose a specialty track. So again, being a family nurse practitioner is the most flexible. You're trained in a primary care model, and then you can sort of move based on training and finding a physician that's willing to train you in a specific specialty. In my case, I did a dermatology fellowship, which are kind of rare, but there are actually more fellowships for NPs being introduced around the country in several specialties and in primary care. But there's also an advantage of being just a women's health NP because you're specifically trained in that. And then I think that makes you more marketable. And you can be, one that I didn't put on the list there was, you can be trained to be an acute care nurse practitioner. And you actually have some good lateral movement with that as well. I have a friend who is an acute care nurse practitioner. She actually works in bariatric surgery at Lahey Hospital in Boston, but she is now doing some ICU work because of COVID and because she was trained that way. So, there's opportunity for NPs to do things that they're passionate about. The reason that I chose NP was because I was really passionate about public health, and Doctors Without Borders only would hire NPs. They wouldn't hire PAs. My dad's actually PA. But my life kind of took a different turn. But if I ever want to do that and go back to that, I can. So, and then everything else that Joe said about timing, I was older, I would still be in school if I went to med school. So that you have to decide early if you want to be a doctor, in my opinion, and kind of still have a life.
That's not an end all be all though. I have one of my best friends in the world. I was in the Marine Corps with. He is in his second year at University of Michigan Med School.
Oh, power to him.
Yeah.
But I think at the end of the day, you're going to be old regardless of what you do, right? Time's going to go by.
That's true.
It doesn't stop for you. It doesn't stop. And so you might as well pursue a career that is consistent with who you are authentically, deep down, so that when you wake up every day in the morning, you look at yourself in the mirror, you feel grateful for the job that you have, so that after a 30-hour shift, it's the middle of the night, your things aren't going well for your patients, you're still grateful, you know why you're doing what you're doing. So to me, that's more important, is to understand why you're doing it, because the fact is we all will get old at some point.
I think there were some other questions. Does it matter what course the professor who writes your letter of recommendation teaches? Science versus non-science versus prerequisites? I think it's helpful to have some science based recommendation.
I think I'm gonna echo Dr. Chung on that one. I think if you're a person who is interested in psychology and doing psychology volunteering, and you're sort of doing something along those lines, then, well, it makes sense for you to get a letter of recommendation from a psychology professor versus a biology professor or something along those lines.
Yeah.
I think it was a requirement for my MP school to have a science recommendation. Yeah. Now that I'm thinking about it.
Yeah, so I think you need to meet all the requirements. If they say 2 have to come from science professor, you need to do that. But once you meet those requirements, go for quality, go for depth, go for character. Don't go for anything else.
Okay. Was there any other questions? Looks like.
I think we've gotten them all.
I think that is it. Good job, guys.
All right. Well, first off, I want to thank everyone in this process. I want to thank Liesl and Dr. Chung for sort of putting this together and creating a forum for us to provide a little more education and service to be able to answer some questions that you guys might have and provide a little bit of our knowledge that we've accumulated along the way. Thank you to Emily. I appreciate you taking the time to look at the PowerPoint, add some stuff, and sort of contribute also and answer questions. And I guess it's up to you guys if we want to answer this last question or not.
Last question.
Can you please explain why each of you personally love your job?
That's a good question, actually.
You guys go ahead.
So I'm not going to, so a very specific, so I'll give you an example of how I really love my job. So when a person comes in with a particular condition, let's just say really bad acne, the person has been dealing with it for years. They've tried everything they possibly can. It's affecting them physically, it's affecting them socially, it's affecting their mental health. If I am able to utilize the tools that I have available to help get them clear, to get them to a place where they want to be, if I'm able to get their rash cleared, if I can help them in their life and their journey, that's what I personally love about my job. If I can get a person an individualized treatment that makes them feel better about themselves, their lives, and their health, that's personally what I love about my job.
I have a little bit of a different answer. I love the trust and the relationships that I build with my patients, and the patients who come back to me every 3 months, 6 months, 1 year, and we get to catch up on how they're doing, and just having like a long-term relationship with a patient is really, really fulfilling for me. Sometimes I help them with what I think is a very minor problem and they're super excited, and that's great. And sometimes it's a really challenging case and we have to just work together for a really long time to try to make them better, and do whatever we can, even if it's a basically untreatable condition. So that's what I love about my job. I also love my autonomy, and I honestly, this is a little plug for Vanguard, but I love working at Vanguard. I love having Dr. Chung as my supervising physician. He lets me do what I want, which is wonderful. Not every practice is like that. He puts trust in me which is very reassuring and confidence inspiring for me as well. So it's not just seeing the patients, it's finding the right practice and finding the right culture in your workplace.
So I'm going to conclude by saying that there is no perfect job. PA, NP, MD, there are people who are fulfilled doing each of these roles. There are people who are miserable doing each of these jobs. There are professional athletes who make millions of dollars and they are miserable. There are some professional athletes who are very fulfilled. There are teachers who are miserable. There are teachers who are fulfilled. And so as you think about these different careers that you're about to enter, you need to step back and realize that there's no career that would do it for you, okay? But instead, you need to flip it around and saying, based on what I know about myself, what makes me fulfilled, where do I derive my sense of joy, gratitude, and satisfaction? Which of these careers make the most sense? And so you gotta, the burden is on you to reflect and to understand where your sense of joy and fulfillment comes from. You cannot put it on any career or any test score that you take or the decision of the admissions committee. So I hope that makes sense. But when I step back and think about it, that yes, you can have a fulfilling career in any of these different careers we're talking about, and it's really a matter of trade-offs. And so I'd also recommend too that if you're thinking about any of these careers, to pursue mentors, to talk to people, and pick mentors in each of these fields who find satisfaction in their career, not the ones that do not find it satisfying. And I would shoot to emulate them.
Thanks, guys.
Joe, anything else?
No, that should cover it. Like I said, thank you to all the panelists, and thank you to everyone who actually decided to get the information that we're putting out. We appreciate it.
Thanks, Joe. Thanks, everybody.
That's right. Bye.